If I had a magic pill that could take pain away, would you take it?
No,
How come?
because it makes you feel real.
Makes you feel human?
Yes.
What if you could take a pill that just took pain away entirely?
Oh, that would be awesome.
Life is about feeling, and if you don't have any more feeling, you wouldn't want to take it. If something was hurting me, I'd want to know about it. I just learned to handle the pain.
I can feel dull and sharp, hot and cold. I can't feel extreme hot or extreme cold, and I can feel hugs and kisses.
I can feel pressure, touch, texture, but like in different levels of pain. I can't feel it like if I got poked with a fork or stabbed with a knife. It didn't really.
Well, I knew that I was different in a way, but I didn't know I was that different.
Gabby and Ashlyn have an extremely rare condition called congenital insensitivity to pain. And ironically, although they don't feel pain, they suffer enormously.
Pain's there for a reason. You know, it's there as an alarm system.
Roberto's mother, Susan, an emergency room nurse, started to notice something was wrong when he was 3 months old.
He was constantly chewing on his hands, had his hands broken down, bright red blood would just pour out of his mouth. And, something isn't right.
How rare is rare enough when you discover people can live in a world without pain? I mean, in a world where we view pain as suffering, practically vilifying pain for every right reason, then suddenly you realize you want that. I mean, a life free of pain, it makes you feel like superhuman. Why would anyone not want that? Then suddenly you are faced with the harsh reality of the freedom you desired, and you realize you could kill yourself before anyone could. Congenital insensitivity to pain with anhidrosis is a rare medical condition that makes it possible for you to kill yourself.
You know, it's there as an alarm system. Your body tells you something's wrong. It tells you when to stop. It tells you so many things.
This is a story of love, patience, and perseverance. It shows how much a parent would give to a child. This is a story of 4-year-old Roberto Salazar, 13-year-old Ashlyn, and 11-year-old Gabby. In the United States, 13-year-old Ashlyn is practicing for her band recital. She is just like any other teenager except for one extraordinary thing. Since she was born, Ashlyn has never experienced physical pain because of her extremely rare medical condition.
Well, I didn't quite know that I couldn't feel pain until my mom and dad told me. Well, I knew that I was different in a way, but I didn't know I was that different.
Since the day she was born, Ashlyn has never experienced physical pain.
I can feel dull and sharp, hot and cold. I can't feel extreme hot or extreme cold, and I can feel hugs and kisses.
In Minnesota, 11-year-old Gabby and her sister Katie enjoys playing in the snow. It's -7 degrees, but Gabby hardly notices because she too has the same rare medical condition.
I can feel pressure, touch, texture, but like in different levels of pain. I can't feel it like if I got poked with a fork or stabbed with a knife. It didn't really.
That's never happened, I trust.
No.
But you wouldn't feel
No.
something like that.
Here is 4-year-old Roberto Salazar, living just like any other 4-year-old kid who loves playing with his older brothers, but when he gets injured while playing, he never wants to stop, even with pebbles under his legs. How does CIPA disease work? They all have what is called congenital insensitivity to pain with anhidrosis. CIPA is a rare autosomal recessive disorder of the nervous system that prevents the feeling of pain or temperature and prevents a person from sweating. Although they don't feel pain, they suffer appropriately. Parents of the individuals diagnosed with this rare medical condition, CIPA, each carry one copy of the mutated gene and don't show symptoms or signs of the condition. Cognitive disorders are commonly coincidental. CIPA is the fourth type of hereditary sensory and autonomic neuropathy, HSAN, and also known as HSAN4. What causes CIPA disease, one may ask? Normally, pain alters the quality of life more than any other health-related problem, and it is one of the elements of body protection. It interferes with sleep, mobility, nutrition, thoughts, sexual activity, emotional well-being, creativity, and self-actualization. Congenital insensitivity to pain is a rare disorder first described in 1932 by Dearborn as congenital pure analgesia. Congenital insensitivity to pain and anhidrosis, CIPA, is a very rare and extremely dangerous condition. People with CIPA cannot feel pain.
I would say the first signs that something wasn't quite right with Ashlyn would be when she was about 6 months old. When they were examining her eye, they put dye in it, and at that point it revealed a massive corneal abrasion, and it was so large that everybody was baffled why she wasn't feeling it.
So she'd obviously scratched herself.
At some point she had scratched her eye.
Oh, yeah, the teeth.
Mm-hmm.
What I wouldn't have given to have my child feel pain like we do. I would have given anything. It's a strange little club we have, but...
As parents of those diagnosed, most times notice as early as...
I think the first real sign was when she was about between 4 and 5 months old. She started cutting her first teeth, and she started biting down on her fingers and really destroying those fingers. She would bite down so hard. She would bite down to the bone if we had let her. I mean, it looked like I compare her fingers to like bloody raw meat.
CIPA is caused by mutation in the neurotrophic tyrosine kinase receptor 1, NTRK1 gene. The NTRK1 gene is responsible for giving instruction for the synthesis of a receptor protein that binds to other protein called nerve growth factor beta. Signs and symptoms of CIPA. Signs of CIPA are present from infancy.
He runs and falls. Well, he gets right back up and goes on, whether he got gravel stuck to his knees and bleeding or not.
Fall after fall, bump after bump, no screams, no tears.
He just doesn't understand the concept that, when we see bright red blood, we stop.
Infants may present seizures related to an abnormal high body temperature. Since people with this rare medical condition are unable to sweat, they are unable to regulate their body temperature properly. Those affected are unable to feel pain and temperature. The absence of pain experienced by people with CIPA puts them at a high risk of accidental self-injury, corneal ulceration, or caused due to a lack of protective impulse. Joint and bones problems are commonly due to repeated injuries and wounds heal poorly. Delayed developmental milestones in early years may be observed.
Confronting the horror of their child seriously harming herself, Trish and husband Steve made the agonizing decision to remove their daughter's teeth.
We thought at that time that removing teeth would allow her to heal, allow her tongue to not be so infected. She was getting so dehydrated and her tongue was so swollen she couldn't drink as a baby at one point. She was biting so hard on the tongue.
Patients often have severe learning difficulties, irritability, hyperactivity, self-injurious behavior, and cognitive impairment, but patients with normal intelligence has also been reported. Pain-sensing nerves in these patients are not properly connected in parts of the brain that receives the pain messages.
They actually sewed her eyes shut in an effort to let their eyes heal. So what does a 1-year-old do with her eyes are sewed shut when she's trying to learn the world who doesn't feel pain? She ripped her eyes open. She actually forced her eyes and grabbed the top and the bottom lid and forced her eyes open so she could see.
She ripped the stitches out.
Having already had her teeth extracted, Gabby's left eye was so severely damaged, it too had to be removed.
Of all the things that we've done, all the surgery we've been through, that was by far the hardest day. Because up until everything else we've done, we've been trying to fix something or repair something or maintain something. This was like giving up. It was a loss. We're moving it.
CIPA is extremely dangerous, and in most cases, the patient doesn't live past the age of 25. Although some of them can live a fairly normal life, they must constantly check for cuts, bruises, self-mutilation, and other possible unhealed injuries.
I veered off, I missed the entrance to the track, and I rammed straight into his woodpile, and he had a metal covering. I slid right, because I could only see out of that side of my face. I turned that way, and it totally sliced, and I didn't know. So we're back inside, and it must have been bleeding for a good 5-10 minutes. Yeah, so my grandma gets down there, and she's like, she goes to my mom, Trish, get dressed, we're going to the ER. So I got 16 stitches.
16 stitches. That is extraordinary. And you didn't feel that until somebody pointed it out?
Yeah.
Self-mutilation is an almost invariable feature of this disorder, most often involving the teeth, lips, tongue, ears, eyes, nose, and fingers.
In the kitchen with some boiling water, a utensil fell into the water and you just instinctively went to put your hand in to pull it out.
Yes, I wasn't even thinking at all. It happened so quickly when I put my hand in there until I brought the utensil out.
When you put your hand into that boiling water, I guess steam was rising. You felt nothing?
Nothing at all.
I always tell people, I'd give my right arm for her to feel pain. It's just...
It's difficult.
Yeah.
How rare is CIPA disease? The odds of being born with this rare medical condition is 1 in 125 million people. People with CIPA also cannot feel extreme temperature or sweat, both of which create even more necessary care. However, in a patient with CIPA, the gene encoding the neurotrophic tyrosine kinase receptor NTRK1 gene is mutated in a way that it interferes with and halts the signal of pain and temperature from being sent to the brain.
Big news out of this may be you and your colleagues might be able to find a way to treat those who suffer chronic pain.
Correct.
So Ashlyn and others like her hold the secret, the key.
That's right.
Most people with congenital insensitivity to pain will show the following symptoms: pain insensitivity, where there is no reaction to pain sensation caused by cuts, burns, or injuries, repeated severe injuries, and accidental self-injury, like severe bite wounds on the tongue, mouth, and fingers, anhidrosis or hypohidrosis that reduces the ability to sweat.
The target on the horizon is to make someone completely insensitive to injuries. In the right settings, for example, in emergency rooms or during acute injuries, to avoid the incapacitation that can occur with often severe acute pains, this would be a very, very promising target.
What would you hope for would come from that?
To help other people that feel suffering from pain, chronic pain. I would be very happy if I could help them.
It would be amazing. An amazing accomplishment, I think, if, she does hold the key. There is a reason for everything.
Reaction to extreme temperature, recurrent high fever, possibly with febrile seizures. Lack of corneal reflex, which is when you
impressive.
blink as a reflex to something touching your cornea. Intellectual disability.
Tell me everything, okay? Like,
CIPA symptoms can vary among people with the condition. You may see either a few or several of these symptoms in one person with CIPA. While congenital insensitivity to pain is extremely rare, check with your child's doctor if they don't respond to pain or repeated injuries themselves.
Gabby, I get the feeling nothing is off limits for you. You could do anything you wanted.
oh yeah. I've been told that many a times too, so it must be true.
It makes no difference to him if he goes into the bathroom and turns on the hot water full blast or the cold water full blast.
Kids with CIPA often have a lot of injuries. They do not get the pain signals that would teach them to avoid things that are dangerous, e.g., the pain of burns helps them to learn not to touch a hot stove, get infectious or have injuries that don't heal because they do not instinctively care for them and try to protect them from things that would cause more pain. If a provider notices that a child is not responding to pain normally, they might want to do more tests to see if they could have CIPA or any other sensory problem. It is usually good to get help or hit the emergency line when body temperature is above 103 degrees, hot, red, dry skin, rapid, strong pulse, headaches, dizziness, nausea, confusion, loss of consciousness. Other symptoms of CIPA could include slow healing from skin and bone injuries, chronic bone infections, malformation caused by lack of sensation, fever-related seizures, dental cavities, difficulty with bowels and bladder control, behavioral problem, intellectual disability. Now the question on everybody's mouth is if CIPA can be treated. Unfortunately, there is no cure for CIPA. There's also nothing that can replace missing pain sensation or make you sweat more. At this point, you just realize how much pain is a blessing. Treatment for CIPA is really above living as safely as possible with the condition. For caregivers of children with CIPA, this means teaching them how to manage their activities and care for themselves, since they'll be getting pain or temperature signals to help them out. Patients with this rare medical condition can avoid exhaustion in hot environments, stay in the shade as much as possible when outdoors, rest often in the heat, drink cold liquid or eat popsicles, wear lightweight, loose, light-colored clothing made of breathable fibers like cotton, use air conditions indoor when possible, use cooling products such as neck wrap, bandanas and vests or cold compressors. Take cool bath, especially before and after exercise. Go to swimming pools. Use a kiddie pool at home. CIPA is a rare medical condition, making it challenging for families to cope. Joining the support group, especially one for a common disorder that most people don't know about or understand, can be a relief and make you feel less alone. These resources can also help you find practical ways to make living with CIPA easier. Since CIPA is an inherited disorder, adults with the condition will want to discuss it with their partners and providers if they are thinking about planning for a family. Managing CIPA typically requires a team of health professionals, including geneticists, neurologists, orthopedists, and dentists, including psychologists, who all work together to address various aspects of the condition. Living with CIPA helps you appreciate the ability to feel pain. Pain is the body's alarm system. Without it, you may not know that you have injuries, even if they are serious. You may re-injure yourself regularly because there is no pain to signal to help you avoid doing so. For example, without pain as a cue, you might not realize you're doing too much on a broken leg that is trying to heal. If you have CIPA, it's important to learn how to prevent injuries and to monitor any injury you get carefully so they don't become infected or more damaged. It's also important that the kids with CIPA learn strategies for staying safe. Thanks for watching.